It's wonderful to have so many people here. Thank you all for joining us. So for those of you who haven't been to a Workforce Lecture Series lecture before, the goal of these lectures is just to inform both current students but also community practitioners in a variety of fields, from social work to nursing and education, about evidence-based practices, their uses, and as well as referral and basically just practical information that you can take away with you into your practice or into your studies in about an hour. So thank you for joining us, and I have the pleasure of introducing to you our speaker today. His name is Dr. Kevin King. He's an assistant professor in child clinical psychology at the University of Washington. Dr. King is a member of the Motivational Interviewing Network with expertise in the treatment of children and adolescents. His research interest centers on the etiology of substance abuse and use during adolescence, and specifically focuses on how individual differences, such as the degree of impulsiveness, interacts with the environmental and interpersonal context to produce risk across development. He has been co-investigator on several federal-level grants to examine substance use in youth, and is the author of numerous peer-reviewed publications appearing in major journals, including Addiction, Journal of Abnormal Psychology, Journal of Consulting and Clinical Psychology, Journal of Clinical Child and Adolescent Psychology, and Prevention Science. So not only is he an exceptionally well-qualified speaker with you today, but I've also heard he's quite a pleasure. So please join me in welcoming Dr. Kevin King.
Thanks for having me here today. And when you hear about me that way, it kind of sounds like a snooze fest. And I promise I won't talk too much about my research for you today. But I will try to give you somewhat of an overview about what motivational interviewing is about and what it's like. I'm going to give you a general, this EVP lecture series is about treatment with children and adolescents, but I'm going to give you a general overview of motivational interviewing as an approach to treatment, and just tell you that it generalizes to most populations. So I have some citations for work with adolescents, but there's nothing necessarily specialized about how you do work with adolescents. And we can talk, if there's room for questions at the end, we can talk a little bit about how you might adapt it to work with children, but really when you're doing MI with children, you're really doing MI with the parents, and then it's with adults, and then you don't adapt it. So what I'm hoping to do is give you a little bit of a sense of whether or not MI works. Hopefully I'll give you some reasonable case that MI does work, give you some sort of sense about how it works, and give you a little bit of just a flavor about what motivational interviewing is like. But first I want to start with a vote, just your gut instinct. I'm going to give you 4 choices. What do you think is most effective in producing behavior change? And don't vote until you see all the choices. Let's just do a show of hands. So don't vote until you see the choices. Would it be giving somebody reasons to change? Listening to someone's thoughts about changing? Would it be teaching someone some ways to change, or providing some consequence for not changing? Who here would vote for number 1? Raise your hand. Who here would vote for number 2? Listening to someone's thoughts about change. What about voting for number 3? Teaching someone some ways to change. What about number 4? Giving them some kind of consequence, like an intervention. Who here would vote for an intervention? Okay, you guys are reading ahead in the book. I didn't even assign a reading, and you guys are reading ahead. Okay, well let's try a brief exercise. Let's see if we can change some minds that have not yet been necessarily changed. I need 1 volunteer. And before I ask for the volunteer, I want you all to think about some behavior in your life that you'd be willing to share with the group. So it can be really, really relatively minor. Like for example, we've had parents who struggle with whether to let their 3-year-old sleep in the bed with them, or whether they should make them sleep in their own bed. You know, something that you'd be comfortable sharing with people that you've been thinking about changing, but you haven't made a change yet. 1 volunteer who'd be willing to share that with the group. You're going to have to come up and tell us just a little bit about it. 1 volunteer. Okay, come on up. What's your name? Mikhail? Okay, come on, let's have a round of applause for Mikal. She's very brave coming up here. She has no clue what I'm about to do. We have not met beforehand. I'll send you the check afterwards. Okay, so Mikal, what's the thing you've been thinking about changing?
Reducing sugar intake.
Okay, so you've been thinking about reducing sugar intake.
Yes.
Okay, what I want you to do, and can you tell us any more about, like reducing sugar intake, like not necessarily what you've thought about changing, because I'm going to have you go out of the room. Maybe tell us about why, a little bit more about that story, reducing sugar intake.
I'm sugar sensitive, so the more I eat, the more I want to crave it after every meal.
Okay.
I want chocolate all the time.
Okay, so it makes you feel pretty bad, and you feel this like escalating cycle of sugar craving, kind of.
Full for all that.
Right. Yeah, really, really sort of, yeah. Okay, cool. So I want you to leave now. Give me a sec, guys. So I want you to leave the room, and we want to close the door, and I want you to come up with as many reasons or as many ways of making this change, of reducing your sugar intake, as you can possibly think of.
Okay.
And I'm going to have these guys, my panel of experts, come up with as many as they can think of. And then we're going to come back and compare notes, okay? So go ahead outside, and we're going to brainstorm for you. I want you to brainstorm, or we're going to brainstorm. So we're going to close the door after you. We're going to give you like 3 to 5 minutes. Sure. Can somebody give her a paper and a pencil, or you got one? You got your own? Okay. So all the latecomers are going to have to stop showing up. Okay. So you guys have a good sense of it, right? She wants to reduce her sugar intake because she's getting up there in years, and she wants to, it makes her feel bad. She's sort of feeling like it's not any good. All right, so go ahead. Let's just make a list of all the things that she could do to reduce sugar intake. Go ahead and just shout them out to me. Get rid of sugar in the house. Okay. What else? Substitute. What else? Smoking? Okay. Both are legal. What else?
That second one will not help the sugar.
Okay, maybe that's true, right? There's a question mark next to the pot. So what else? What else could she do? Support network. What else? Reward if she does what? Okay. What else could she do? Make a list of all the reasons she loves sugar. Buy healthy substitutes. Positive self-talk. Come on, we all know that never works. It didn't work 100 years ago when people tried to repeat it over and over again. What else could we think of? Keep a journal. Okay. What else? What can we think of? Okay, join a anti-sugar league. Increase self-discipline? How? Monitor intake. Okay. Okay, let's, one more in the corner. Medical assessment, okay. Okay, that's a nice list. Let's see if she's come up with a prohibition solution. Okay, so we got 12 solutions. This is a pretty good list. How many people do we have? A lot of people here. This is a pretty packed room. So let's see if the power of the group can overcome the power of the individual. Let's see how we're doing. Are you ready?
Sure.
All right. They have a lot of things for you to try. So why don't you come on up and let's share. Let's get your list on the screen.
Okay,
So-
so things that I can do to
Yeah,
try.
things that you can try.
say no.
Okay, just say no. The Nancy Reagan approach. What else?
Just allow myself a sugary treat once a week.
Okay.
A 30-day challenge.
Okay, 30-day challenge.
I can eat the chocolate as much as I want, but then I need to work out in the morning, run at lunch, and run again after dinner.
Okay. Okay, so compensate with exercise.
A lot. I'm in my mid-40s. Wait 15 minutes during the craving and see if it's still there after.
Ooh, I like that. There you go. That's how you increase self-control. Maybe you do a little bit. Wait 15 minutes during craving.
We have an attorney at my job where they keep.
What did you? Are you a social worker?
Yeah.
Wow, you must be good. These are really good. These are. Sounds like
There's
science.
an attorney in my office.
Okay.
Chocolate outside her office.
Lawyer up.
So I can walk around like 3 times before I go to the envelope.
Oh, okay. So that's actually a little bit. That's actually kind of like waiting 15 minutes, right? It's a little bit of delay.
Yeah, I can reward myself after a 30-day challenge with a new pair of running shoes.
Okay.
I could drink water instead of going for the sugar.
Okay. Substitute.
Yeah, substitute. I could try healthier sweets. Like I could bake, pumpkin agave muffins or something.
Nobody likes those. I don't.
I could do some deep psychological work to figure out what my triggers are.
Okay.
Why do I need the have
Figure out triggers, which could be.
stress?
And I'm just trying to make a list of all the reasons you love sugar. Maybe I'm just trying to.
Well, it's the dopamine. It increases the dopamine,
Right.
serotonin levels.
But that's not going to help. The psychological work's not going to help
But
the
if I
dopamine.
but if I could do a replacement or figure out why I'm
Uh-huh.
craving those things, but
That would be the
it's just
substitute.
the pleasure principle.
Okay, so let's. No, this is great. Did we get them all? Figure out.
Those are the main ones.
Okay, that's awesome. You came up with. Okay, so first, man, you guys are not as good as this. You're pretty impressive. So first, I want to point out this huge group of people came up with 12. I'm being judgy here, but 12 okay ideas for her, and you came up with 11. And there's actually not that much overlap, which I think is pretty cool. Now let's go through their list, and I want to hear your genuine reaction to them. And I want to see if this microphone is on. I think this microphone is on, because I think it's cool to hear. Can we talk through the list, and I want to hear what
Sure.
you would say about each one. Okay,
Yeah.
how about just getting rid of all the sugar?
Tried it, but I also have kids, and
Okay, so you tried it, but your kids are sugar hounds.
I will scour the back of a cabinet looking for fallen chocolate chips.
Right. That dopamine craving is really strong.
I'm serious. I mean,
Yeah.
that sounds
Substitute. You thought of that, and I misspelled it, so that works. How about smoking cigarettes?
funny. No.
Okay, not going to work.
happen.
I thought of smoking weed because it's going to be legal, but somebody pointed out probably accurately that's probably
It's harder
the worst
to run
idea.
when we do those, and I'm a runner. so-
Yeah, and it's hard to where do you put out the cigarette when you're running, and
Yeah.
are you going to burn people? How about a support network?
I've tried that.
Okay, you tried that, and
Yes. Yeah, I didn't. It helped with 30. I was successful one time with 30 days.
okay, but
I wore my friends out.
okay. Okay, so she actually lost some friends because of that. Rewarding yourself. You actually kind of came up with that, rewarding yourself after the 30-day challenge. Okay, kind of like that. What about making a list of all the reasons you love sugar?
It's simple. I've done that. Yeah.
Okay, so you're sort of already there. You're ahead of that. How about buying healthy substitutes?
Yeah, we tried that.
You sort of said that, tried that, yeah.
Has anybody ever tried the carob chocolate? I mean, really? Yeah. See.
There's a reason there's not that many, yeah. Or you buy that licorice, the sugar-free licorice, right? It's really good going in, but
I've
coming
tried
out,
gum. Just have a stick of gum.
Uh-huh.
That does help.
That does help, okay. Positive self-talk, just sort of talking yourself up, I can do this, I can.
Yeah, I do that every day. I try that.
Okay.
That
How's that working
it's
for you?
successful on the times that I don't have any chocolate.
Okay,
Like
so
so
it's
far
successful when it's successful.
Yeah, so
and
far.
when it's not,
So far, today's good.
okay. Okay, how about keeping a journal about how you're feeling?
Yeah.
Okay. How about, this was just me being funny. It's joining a support group of other
Yeah.
people trying to, so it's sort of different than gathering a support
You know, there is
network.
one, but she wants like $600 a month, and that's not very. Yeah, there is one. I found one, but she wants like $300 to $400 a month,
She's
and
secretly buying chocolate
I'm
with
just a
it.
poor social worker.
How about monitoring your intake?
Yeah,
of-
I do that.
You do that?
Yes.
Okay. How's that work for you?
Yeah, that works so far.
So you'd actually probably be further ahead if you
Oh,
weren't
yeah.
doing that already. Okay.
Yes.
And how about a medical assessment?
In medical insurance is too high.
Okay. So, okay, thank you very much. This is really helpful. Let's talk about this just for a little bit. Let's give her a big round of applause. Thank you. So what's the difference between the kind of advice that we came up with for cutting down sugar intake for another person and the kind of, I have to say, fantastic advice that she comes up with for herself? How often did she butt us during that conversation? Almost every single thing that we came up with, there's not a single thing, I think, that we came up with that she hadn't tried, hadn't thought of, or that unless it was something that she had tried, substitute, oh yeah, that works. Or I'm already doing it. I'm already with you, right? People probably don't need our advice on a lot of behaviors. Now, there are certainly some things where they do need advice. They do need our expertise. But a lot of times they don't. And the data actually support this. Confrontation and education don't seem to be very good at changing people's minds. So these are meta-analytic data from treatments for alcoholism. And the top 4 treatments in rank order of 46 different treatments are brief interventions, which generally include motivational enhancement, motivational interviewing, motivational enhancement, 2 drugs. Imagine that, drugs to treat addiction. They work. We actually should have more of them. We have way more drugs for depression than we do for addiction. Why? Because people are weird about giving addicts drugs. They shouldn't be, but they are. I don't know why. What are the things at the bottom? Confrontational counseling. We have TV shows about it, but it doesn't work. General psychotherapy, general alcoholism counseling, and what's at the bottom? Educational lectures, films, and groups. So that tells you that based on the data, what I'm giving you today is the least effective way about learning about motivational interviewing. I'm sorry, but it's true. Providing confrontation and providing education is the least effective way of changing people's minds and changing people's behaviors. We also know this from in-session data. So here's some data from a great classic study by Jerry Patterson and Forgatch, where if you look at the non-compliant responses per minute in session, coded minute by minute from therapist videotapes. And what they did was Jerry Patterson trained therapists to act in 2 ways, or in 3 ways, I guess. Some neutral way, either to teach or confront, or in the neutral way, which was just to sort of ask and reflect, ask questions and reflect back what the person was saying. And you can see in terms of non-compliance, which was things like arguing, disagreeing, when they were at baseline, you got relatively low rates of non-compliance. As soon as they move into teach and confront mode, you double the rate of non-compliance. And what's cool about this study is the therapists were trained to shift back after a few minutes into this baseline. And what do the clients do? They mirror that behavior. They go right back. Once the therapist goes back into listening mode, the client gets out of arguing mode. Isn't that surprising? If you're not confronting somebody, they stop arguing with you. It's science. And then once you go right back into confrontation mode, they start arguing with you again. It's science. And yet we don't always operate that way. And these are some of the origins of motivational interviewing. In some of the very early alcoholism treatment studies, Bill Miller noticed that simple ratings of empathy of the therapist explained massive amounts of variance in client outcomes. Something like 25 to 66% of how well clients did, or differences between how well clients did, was simply explained by how empathetic their therapists were being perceived as. And this evolved into Bill Miller's developing the drinker's checkup, which evolved into, so you may have heard these different terms, the drinker's checkup, which evolved into motivational enhancement therapy, which then evolved in a therapeutic style called motivational interviewing. And all of these are ways of systematizing therapist empathy around behavior change. But it's systematizing therapist empathy around behavior change in a very specific way. That's not just non-directive therapy, but it's non-directive therapy with a goal. So it's not simply client-centered therapy, but it's client-centered therapy with a goal of behavior change. So we can define motivational interviewing. I can give you one right here, a definition. A definition of motivational interviewing would be a person-centered guided method of communication to elicit and strengthen motivation for change. But its definition, learning it, enacting it is very difficult and can be very subtle. So let me break down the definition for you really briefly. It's person-centered, meaning that we're always focused on the person. We're always thinking about us as joining with the person, right? We're not thinking about ourselves as the authority on anything. We think about the person as they're the person that has to go out and change their behavior. They're the person that has to go and live with their child 24/7. They're the person that has to stop using heroin or stop using crack or start their diet or cut down on their sugar intake. We're the person that sees them, for the 20 minutes in their intake or for the 50 minutes a week. That's all we get with them. Our job is to sort of help them on their way. So our thought is to just join along with them. And it's guiding. We're not pushing anybody. We're not pulling them. All we're doing is helping guide. We're moving along with them. It's a method of communication because it's very much about how we communicate. Learning motivational interviewing is very much about learning how we talk with people. And the idea is that we're listening and strengthening people's own internal motivation for change. We're not giving them anything. We assume that motivation is within the person and that the reason somebody is not changing is simply because that they're stuck. The reason that they're not changing is that they have reasons for changing and they have reasons for not changing. That they see that the costs of changing are high and the benefits of changing at the present time are low. And what we try to do is help them rebalance those. So one way that we like to sort of demonstrate or illustrate what motivational interviewing looks like is with horses.
Off that wall twice
And
now.
I'm going
wanting to come in
try to
closer.
illustrate what this looks like. So this is Monty Roberts, and Monty Roberts and Bill Miller have, Monty Roberts is the horse whisperer. You might have heard of horse whispering. He goes up to horses and he can talk to them. He talks really quietly. And now we have an ASL interpreter here, so I have to be careful about moving my lips and talking or not moving my lips and talking because I don't want to mess with the hard of hearing people here. But he's known for breaking horses gently. This is a horse that has never had a bridle, never had a saddle at all. And he manages in a 10-minute interaction to get it to accept a bridle and to get it to accept a saddle in this entire time. I'm going to show you just a little bit about how he goes about doing this because I think it's a nice illustration of what motivational interviewing is about. And this is a clip that is shown commonly when we talk about MI. And you'll see what he's doing is going with the horse. He's not pushing against it. He's using the energy of the horse with it. And hopefully you guys can hear and follow a little bit about what he's doing.
My eyes on eyes, shoulders square, pushing away. There's licking and chewing. Very nice. Very nice. So, we've predicted the ear. We've predicted the head and the eye coming over, coming closer. We've nailed our prediction on the licking and chewing. And there's the bowing down. There's the bowing down. Very nice. Super good girl. That's so demonstrative right there. That's just as you see the Mustang do it. There's the licking and chewing again. Quite good. Very good conversation. Next round.
Notice he talks
I
about
will
as a
go
conversation.
passive. Good licking and chewing. I will go passive the next round, take my left shoulder by, and then drop my eyes away from her eyes and reverse the whole procedure. There we go. I'll get myself on a 45 now and invite her in. Very nice.
That harp music is actually natural.
Super good
That happens
girl.
when a horse.
There is the moment of join up. You are a good girl. So I'll tell her how nice she is for coming in here. Invite her into my chest, standing right in front. Don't look her in the eye. I've already done that, and that means go away. Now I want her to be here with me, and she's finding value. And that's join up, and now I'll walk away and attempt to get follow-up. Wonderful. Wonderful. Good follow-up. I'll come around here now and try to make a left turn and have her come with me. Super good girl. On the offside as well, vulnerable areas. And I want to be able to pick up each of her feet with nothing on her head if possible, hoping that she'll stay with me, because when I saddle, I'd like her to stay with me because she wants to, not because she's being made to. Good girl. That's a good girl.
So you see how with each of these, he's going with the horse, and he's using the horse's natural inclinations. He's guiding the horse. He's not forcing it. I have a comparison video, but we probably don't have time, where when they're trying to break the horse, it's over several dates. This happens over 10 minutes. And the comparison is they throw the saddle on the horse, and then somebody steps up into the stirrup and then just flops over. And the horse is bucking and bucks the person off, and then you see day 2. And then they flop on the horse, and they just basically, the horse is terrified, and they just basically wait till the horse gets used to it and extinguishes. And this is a dramatically different method. And I don't claim to be a horse training expert, so if you're, if you are and you're sort of saying, oh, this is, I'm not claiming, but the idea here is that you're going with the natural inclinations of the client. You're not forcing, you're guiding along, you're hoping that you can join up with them and use their energies and sort of bring out their own natural internal desires. What's great about motivational interviewing is that if it's a behavior that a person can consciously decide to change, it can work for. And this is just a short list of things that motivational interviewing has randomized control trials showing that it works for. Everything from physical health to addictive behaviors, anything that somebody can naturally recover from, can naturally decide to change their behavior, motivational interviewing works for. If you can say, I'm going to change this behavior, and somebody changes it on their own, which people do, people change these behaviors on their own all the time, MI can help you change it. And to date, and this is actually a little bit old, over 200 clinical trials. That number is probably bigger. It's probably approaching 300 as of today. Motivational interviewing has also been extensively studied. This is my dog Indy being intellectual. That's why he has his glasses on. It's been extensively studied for adolescents. This is one bibliography of motivational interviewing, RCTs and reviews for adolescents. I had to make the font 4-point size so I could fit all the studies on one page. If anybody's interested in the bibliography, you can email me and I can send you the bibliography of all the studies. I'll also say that Sylvia Naarking, that's Naarking, no relation to me, has published a book on motivational interviewing for adolescents. It's a great book. I'd highly recommend it if you're interested in seeing how you might think about adapting MI to work with adolescents. What's interesting, and I think a little bit exciting, is that motivational interviewing works in some somewhat unexpected situations. With a lot of evidence-based practices, we develop them at universities, And we often find that they work less well the farther away you get from the university clinic setting. It turns out that motivational interviewing actually works better with ethnic minority clients. We think probably because it has such an emphasis on not having a power structure, and it's because it tends to be so client-centered. And these are data that have been repeatedly found in multiple meta-analyses. When the procedures are not manualized, it seems to double the effect. And that's probably not, now it's not when people are not adherent, but when the procedures are not manualized. So when people are adherent, but you don't use a manualized procedure. And when change language is elicited at the end of the session, but not at the beginning. So change language is what we think of as the key as motivational interviewing. And the reason we think that eliciting change language at the end and not the beginning is that we think that getting change language is things, and I'll get to this at the end as well. Change language is when people are saying things like, I need to change because, or I want to change because, or I have to change because. That's what change language sounds like. When people say that early on in a session, we usually think that people haven't actually resolved their ambivalence. Have you ever had a client come in and say, oh, I'm raring to go, just give me the program, I'm gonna quit smoking, just tell me what I need to do, and then they walk outside and light up their Camel, and they walk down the street smoking, right? So MI sort of has these two phases where we think first we have to completely understand, reflect, and resolve both sides of somebody's ambivalence. And then we start evoking and reinforcing this change language. So we think that when you're eliciting this change language at the end of the session, MI works better. What's great is that motivational interviewing also works for a long time following intervention. Motivational interviewing can occur in as brief a session as 10 minutes. Motivational interviewing is not a long treatment. And it actually works very well when it's an adjunct to other treatments. So this, you can see this very, very dark gray line here that I'm pointing to shows, so this would be this one right here, shows when MI is added to other treatments, you can actually see outcomes were best when it was an adjunct to other treatments. And this is what a lot of folks are doing. This is what Marsha Linehan is doing with DBT, is adding motivational interviewing components to the beginning. This is what a lot of folks are doing with their treatments now, is they add motivational interviewing at the beginning of a treatment to enhance engagement in treatment. And like I said, we think motivational interviewing works because people are generally better persuaded by the reasons which they themselves have discovered, rather than by those which have come into the mind of others. I think we all had a nice demonstration of that with the exercise earlier today. We think that motivational interviewing works by some complex model like this. Essentially, what we think happens is that in-session therapists use empathy and spirit of MI consistent methods, which produces clients talking in a particular way, reducing their ambivalence, reducing their resistance, increasing preparatory and change talk, which leads to commitment to behavior change, which in turn leads to behavior change. So basically, it's about how therapists interact with clients, which produces decreased resistance, decreased ambivalence, increased change talk, increased commitment to, and then increased behavior change. And this is really important, motivational interviewing does not work when therapists shift towards planning too early. What happens if you say, I'm getting ready to start a diet, and I come to you and say, I've got this great diet and exercise plan for you. Let me tell you, it's got 5 points. The first one is to eliminate all sugar in your household. The second one is to get a seesaw. It's this amazing seesaw that I got for you. It's weighted on both sides. It's going to make you fit as a fiddle. Who's ready to buy that seesaw? In fact, what's your common reaction when somebody comes to try to sell you that seesaw? Yeah, right, right, exactly, right? No, I don't want that seesaw. In fact, you want to go out and buy the opposite of, what's the opposite of a seesaw? I don't know what the opposite, that was a terrible metaphor. A plank, a non-seesaw. I don't know what the opposite of a seesaw is. Damn it, that was the worst metaphor ever. You want to go out and, right? What happens? Because ambivalence is actually like a seesaw. When you push on one side, people push back on the other. So you have to be really careful about prematurely focusing on change. Let's try this. This is one of my other dogs, Jack the dog, in his therapist mode. He does a little bit of phone therapy every once in a while. So let's do a persuasion exercise. Pick one person right near you, preferably not a boss or a supervisor. You're going to have a brief conversation with them. One of you is going to be the speaker and one of you is going to be the counselor. So go ahead and find another person. This is going to be like a 3-minute exercise. Find somebody and try to keep it quiet because we need to come back for instructions. Okay, so here's your instructions. One of you is going to be the speaker, and this is what I want you to talk about. I want you to talk about something about yourself. We've heard this before, right? Something about yourself that you want to change, that you need to change, that you should change, or that you've been thinking about changing, but you haven't changed yet. In other words, something that you're feeling ambivalent about. And this should be something that you feel comfortable about sharing. No deep, dark secrets. And we're not going to ask you to share it with the group either. Okay, so just feel comfortable that you're sharing in this group. So speakers, whoever's going to be the speaker, you know what you're going to say, you know what you're going to talk about? Everybody got it? Okay. The counselor, here's your job. The counselor, here's your job. Find out what change they're considering making, and here's all I want you to do. This is really, really simple. Explain to them why they should make this change. Give them at least 3 specific benefits that would result from making the change. Tell the person how they should make this change. Emphasize how important this change is. And persuade the person to do it. I'll leave these up here so you can remember. And if you meet any resistance, just repeat the above. Okay, you ready? I'll give you about 3 minutes to do this. Ready? Go. All right, go ahead and finish up your conversations and let's come back together. So go ahead and take about 20 more seconds to wrap up if you can. Okay, about 10 seconds. Okay. So, obviously that was not motivational interviewing. I promised you I couldn't teach you motivational interviewing in a 50-minute lecture, and I'm not going to try. But I could certainly give you a taste of what it's not like. I'm curious, what was that like for you? Just any reactions? What was it like to be the speaker? Yeah, what was it like to be the listener? Okay. Okay. Right, you got to feel the power of being a doctor. Right. Okay. What else?
Are we in the counselor side or the?
Well, just tell, what was your role?
I was the speaker.
Okay, yeah.
I felt really like I already heard it all, and it was just not making me feel any better. And like, yeah.
Yeah, you had already heard it, you were being talked at, kind of, yeah. What?
I even knew better than her the reason.
Yeah, right. Right, I knew the reasons better, yeah. You didn't speak much. That's very common. The speaker does not actually speak much, yes.
I kept coming up with excuses in my head of the like thing.
Uh-huh, uh-huh,
As she was saying
right.
resolve myself,
That seesaw is pretty powerful, isn't it, right? When they,
made me feel like worse.
less likely to maybe make that change, right, yes. Uh-huh. It's a lot of work. Yeah. God, are you guys surprised at how lazy half of this group is? And how reticent and how, like, we had to work hard, didn't we? How, I mean, seriously, don't they know how, what are the reactions? Yeah.
As the counselor's role, I felt really uncomfortable. I thought I was just like grabbing at random things that I thought might help.
Yeah. Right, so it's funny, you can vacillate between, depending on what they come in with, right? You could feel, oh, I'm totally the expert, and you're either gonna bludgeon them with your own experience, or you're gonna come in and like, it's a lot of power. And sometimes absolute power corrupts, and sometimes absolute power, I don't know what, yeah, right. It can be terrifying either way. It's a lot of work.
When the counselor was talking to me, I just realized he's right. I am a failure. Those are all the reasons. I am a failure.
Did anybody else feel that awful? Did any other failures in the room? We can have a support group, it's okay.
And it's totally not even what he was saying.
Right.
But he was just giving me all the reasons that I already knew.
Right.
So I felt even more.
It's
failure.
easy to compound our failures. Yeah.
I was the counselor, and as she was resistant, I felt myself getting more aggressive.
Uh-huh. What happens when what happens when we push and they push back? We naturally want to, right? When we get oppositional with our clients, they push back, and our natural instinct is to push against them as well.
I lost faith in my counselor when she recommended an alarm clock to help me get up earlier.
Oh my God, who gets, yeah, exactly, seriously, who think, alarm clocks? I get up with the sunshine, and I have a rooster. Who needs an alarm clock? Seriously, it stands on my head and caws in my ear. An alarm clock? What is this, the 21st century? Seriously. It is, isn't it? No, I don't even know where I am. Right. Right. That's terrible though, right? You lose faith. This is a really powerful statement. I lost faith in my counselor, right? You get angry with them. Or if you're the counselor, you get angry with your client. Now, be honest, for those of you who have done or are doing therapy, how many of you ever felt that way about a client? Right? Part of the point of this exercise is not just to show you what and motivational interviewing is not, but it's also to show you the power of how we treat and what we can do when we engage in these behaviors with our clients, how we can evoke certain kinds of reactions just by engaging in these kinds of advice giving, this kind of power struggle, this kind of pushing against our clients. We can evoke specific behaviors. And if we switch, you can do a complementary exercise. Unfortunately, we don't have time, but you can do a complementary exercise where you switch this around 100%. And all you do is you can even do this with clients. It's really simple. You just, instead of saying explain why, you just turn these all into questions. You just say, why might you make this change? Could you tell me at least 3 benefits about why making this change might be good for you? Have you thought about what are some ways you might make this change if you decided to try to make it? Why might it be important to make this change? If you just ask those 4 questions, how do you think the interaction is going to go? Way different. And we do this, when I do this exercise in training, and then you do the persuasion exercise and then reverse it, way different. And it's just a matter of how you interact with your clients. The science that Jerry Patterson did 20, 30 years ago is not wrong. It still holds today. The way that we treat and interact and talk with our clients still matters. Motivational interviewing is based in this client-centered spirit. It's based around a spirit of collaborating with our clients, of evoking change from within them, and supporting their autonomy. But I have to tell you that empirically, global ratings of spirit are unrelated to client outcomes. So when people have done studies and rated therapists on spirit, they haven't been able to link it to how well clients do. We're not sure if that's because most therapists are pretty good at spirit, or if it's because spirit, it's not about spirit, but it's about techniques. We're not sure about why that is, but nobody's yet ready to give up. We still think that collaborating with our clients, trying to evoke change from within, and supporting the autonomy of our clients to make decisions, because in the end, we believe that it's our client's treatment, it's our client's choices, it's our client's behavior that they have to change, not our own. That's the gas that drives treatment. And I referred to it earlier, the initial phase of motivational interviewing is all about being client-centered. It's very Rogerian. And we use specific techniques called our ORs. And the ORs are really what drives the initial phase of motivational interviewing. This is where we're very client-centered, we're very non-directive, and we're not pushing for or guiding or searching for any kind of change. You can ignore the wording on the cartoon. It's just a bunch of rowers that I found to illustrate. So what do ORs mean? ORs are very basic client-centered skills. ORs are open-ended questions, reflective listening, affirmations, and summary statements. So open-ended questions, things like, how does smoking fit with your role as a lead singer in a chorus? Versus closed-ended questions, how many cigarettes did you smoke today? Now, I'll note that both open-ended questions and closed-ended questions are directive to some degree because questions inherently set some kind of agenda. But open-ended questions allow for a lot more room. And the idea is that open-ended questions allow for the client to share their side of the story. When you were the speaker in this exercise and you were talking, how many of you felt like you wanted to explain more of your side of the story? Yeah, a lot of you wanted to feel like you wanted to explain your side of the story. When we give clients closed-ended questions, we're forcing them, we're often making them feel like I want more to say more of my side of the story. Open-ended questions allow them to give their side of the story. Reflective listening is really the heart of motivational interviewing. It's really the heart and soul of all MI. And reflective listening, good reflective listening, and most of you should know lots about it, is really the heart. So even though it's only one sort of block of the ORs, it's the main block. When we code MI sessions and we're looking for good adherence to motivational interviewing, we're looking for a ratio of something like 3 to 4 reflections for every open-ended question. Something like 3 to 4 reflections. And we're looking for reflections that go beyond "it sounds like," or "it seems as if," or even just "so." We're looking for really concrete things. And things that also go beyond simply repeating back to somebody what they're saying, but go beyond towards a little bit of interpretation, towards taking guesses. What you're essentially doing with reflective listening is taking some guesses as to what a person might be thinking or feeling or doing or saying. Because communication is all about trying to get ourselves understood. And reflective listening is about trying to understand. Affirmations are sort of a form of reflections that add a little bit of a value judgment. And what they really do is just try to maintain and increase motivation. And summary statements we use as a way of making sure that there's sort of a collection of reflections that we use as a way of making sure that we get everything that the client is saying. Because people will come in with a lot. They'll have a lot of things to say and a lot of things on their plate. And we want to use summary statements to say, okay, we've been talking about this for a while. Let me see if I feel like it. Let me see if I've got it. And so we'll sort of collect all the summary statements. And you're always giving them a chance with both reflections, with questions, reflections, and summary statements. You're always kind of giving them a chance to correct you. That's the greatest thing about these techniques is somebody says, somebody cut me off in traffic today and I was late to this appointment, and they say, oh, you were really, really pissed off at them. They might say, no, I'm just frustrated that that the construction is so bad downtown. You can take guesses with reflective listening and be totally wrong, and it's fine, right? Have you guys has a client ever gotten mad at you because you took a guess with a reflection and were wrong? A lot of times when people are first learning MI or learning reflective listening, they're worried that they have to get it right. And really, you learn a lot more information when you get things wrong with clients, because they really want to correct you, because people want to desperately want to be understood. So it's really good to get things wrong. And sometimes you can actually get things wrong on purpose to let people correct you, and then you can say, oh, okay, I sort of get it now. You don't want to do it sarcastically, but you can certainly go there. So what you do with MI is you use your ORs to get a good sense of what the dilemma is, get a good sense of how people are, where people are feeling stuck, and then you start developing a discrepancy between where they are and where they would like to be. The idea of motivational interviewing is that there's some state that is inherently good for the person that they are not in. So if somebody is currently a smoker, the assumption is that it's inherently good for them to not be a smoker. If somebody's trying to decide between one kind of designer blue jeans and another kind of designer blue jeans, motivational interviewing is not a technique to help them change that behavior. It's not appropriate. People are using it that way. So there is a guy selling it as a sales technique. It is unethical and inappropriate. So the idea is that any rational person could ethically say that the behavior that the person is trying to change, if they were to change it, it would be overall net good for them. So the second phase is to start searching for, once you feel like you've really gotten a sense of the person's ambivalence, to start searching for and evoking statements around change. We call this change talk. And you can summarize change talk with the acronym DARN CAT, and I found the best image I could think of a darn cat. DARN CAT stands for desire. So the first one, DARN statements, are what we call change talk. Desire, ability, reasons, need. When people state their desire, ability, reasons, or need, they're saying, I want to change, I can change, I should change, or I need to change. You can also think of the exact opposite of that. When you start pushing change on someone, they might give you sustain talk, which is, I don't want to change, I can't change, I shouldn't change, or I don't need to change. And then the second half of that is when somebody's a little bit further along, they're starting to say, oh, I think I'm going to change. Or I'm going to start taking action. or I'm starting to investigate options, or I'm actually taking steps. I'm going to go to the gym on Monday, or I did go to the gym on Monday, or I bought some Nicorette gum, and I started taking a piece. So the seeds of change are when people start talking about it. And the second half is when people actually start committing to it and then start actually taking steps. And MI is about listening for that change talk, reinforcing it, and drawing for more of it. When you hear change talk, you want to reinforce it and fish for more. You only want to do this at the right time. Once people feel like they're really being heard, because what's going to happen if you start asking for more change talk at the wrong time, they're going to start telling you all the reasons why they're not ready to change or can't change. But you can do things like asking evocative questions like, well, what would happen? What do you think would happen down the road if you didn't change how things were going, if you just sort of let things as they were? Using change rulers, querying the extremes, looking back, looking forward, explore. What's important to you as a person? Like when you think about yourself as a person, what's most important to you? Sometimes that stuff is really, really powerful to help people really come up with good change talk. Once you hear change talk, you start using your oars again. We call these our ears because we use specific kinds of oars. We ask people to elaborate, tell me more about this change talk. We give them affirmations, we use simple reflections, and then we summarize. So when you hear change talk and motivational interviewing, you sort of jump on it, you ask for more. It's something that we're really excited about when we hear it in session. And I know I'm running out of time because I think we go to right about now. So let me just tell you a little bit about learning motivational interviewing. It takes time, training, and practice with feedback. Like learning any technique, you have to learn about it, and then you have to train in it, and you have to get somebody to watch you do it and give you feedback on it. Unfortunately, we still have a model in psychotherapy where people sell you workshops, and you go to workshops for 2 or 3 days, and they give you a certificate and say, okay, now you're trained in X, Y, or Z. And we know from the data that that doesn't work. And that's why we have this EBP series, and we have classes where you can learn more in depth, because the way we know that people learn is by doing, by practicing, and getting feedback. And now there are trainings that have people practice and get feedback, and then we know that the way you sort of maintain it is by getting consultation and supervision over time. So Bill Miller and Terry Moyers wrote a paper in 2008 about sort of what are the phases of learning MI. The first, we think, is just getting the spirit of MI, and then using client-centered listening skills, and then recognizing change talk, and then eliciting and reinforcing change talk, then developing, and then rolling with resistance, developing a change plan, consolidating commitment, and then integrating MI with other methods. A lot of you might already be sort of here at using client-centered listening skills if you have basic psychotherapy training. So for a lot of you, learning how to use MI and learning MI would be about recognizing change talk and eliciting and reinforcing change talk, and then it might be about some of the more specifics. And I just want to leave you with a few things that MI is not. MI is not based on the trans-theoretical model of change, Prochaska and DiClemente. We're never trying to figure out, like, is this person in pre-contemplation or contemplation, or that just never comes into our minds. We're just working with what the person is saying at the time. We're just talking to the person. We're just trying to figure out how do they feel, what's going on, what are they saying in the moment. We're never trying to classify them. We think of MI and the trans-theoretical model as kissing cousins. They probably are talking about the same processes, but they're definitely not the same. They're definitely not based on one another. MI is not a way of tricking people into getting something that they don't want to do. It's not really a technique. It's very much more of a counseling style. It's not something you sort of whip out and then unwhip. You unwhip. It's not decisional balance. Sometimes people teach MI as just pros and cons. That's what I've heard people say. Well, MI, it's just pros and cons, right? You just make a list of the pros and the list of the cons, and then you just do pros and cons. It's not pros and cons. It's a lot more complicated than that. So a lot of people think motivational interviewing is motivational enhancement therapy, which is where you give people assessment feedback. Motivational interviewing does not require assessment feedback. That when you use assessment feedback, that's when it's motivational enhancement therapy. That's a specific form of MI. It's definitely not a form of cognitive behavioral therapy. They're basically unrelated. You can use them together, but it's not a form of CBT. It's not just client-centered counseling because it very much has a directive focus. It has an end product. It has an end goal. It's looking to change behavior. And I have to say, it's not easy. It's not easy to learn. It's not easy to do, but it's very deeply satisfying. And it's probably not what you're already doing as well. And this is just something as a reminder to all of us. If you haven't been trained, if you haven't gotten feedback, a lot of times people will see something and go, that kind of sounds like what I'm probably already doing. It's probably not. And we really have to look at tapes. We have to listen to tapes to really, if we really want to know what we're doing in sessions, we got to look at ourselves. We got to code. We got to write. And I can't imagine if you're out there practicing and you have 30 clients a week. I'm not saying that it's easy to do that. So I'm not proposing that you should go look at see 30 clients a week and then go watch 30 hours of tape. I'm not saying you can or should do that. I'm just saying that unless we're actually doing any kind of review, we don't necessarily know what's going on in our sessions. And it's not a panacea. It doesn't work for everything. And we think it works for behavior change, and it's not going to work for a lot of other stuff. So I'm happy to take any questions afterwards if there's any time. If you have to go, I also understand. So thanks very much for having me, and I appreciate your time and attention today.
Thanks so much, Kevin. We do have like 5 minutes to take a couple of questions. If you do have an evaluation form, I didn't have enough for everyone, I apologize. This is a very well-attended lecture. If you do have an evaluation form, though, if you could please fill it out and leave it here at the corner of the front table, that would be great. So like I said, we have time for a couple of questions, and I'm going to pass the microphone if anyone has any questions. Yes.
Hi, I work with teen parents and their babies, and
So it's not going to work with babies.
right. But with the teen
Yeah.
parents, we need to have them write down a goal
Yeah.
within 90 days of first visit, seeing them. We do home visits. I guess sometimes it's a little awkward to like first meet someone and have them write down a goal.
Yeah.
Do you have any advice about getting towards that change and
So what are some of the goals that what are some of the goals that you're looking for them to write down?
Ideally that they would write down a goal about parenting, about their family, a family-centered goal.
Mm-hmm.
But
I guess I'd be curious about the way you guys approach it, but my instinct would be to approach it with what are the things that you're hoping for with your baby or your family? What are the things that you're wishing for? And maybe just have a conversation about as you look forward for the first year of your life, what are some of the things that you hope to see happen in your life? Just do some envisioning, some looking forward, some of that sort of bigger picture stuff. Some of our clients it's going to be hard for, and they're going to be maybe focused on minutia or but I might start with some of that stuff because for parents, kids are a really powerful motivator, and wanting the best for their kids can be a really powerful thing. And then maybe if it comes down to a goal, then if they have a bigger picture thing, then maybe you think, okay, well if you want your baby to be here, what's a goal to get them there? So you can use the open-ended question stuff to sort of help you get there, and thinking about goals and values. I'm not sure if that's already what you're doing though or not.
it is. I mean, we have them write a long-term goal
Yeah.
and then steps to get there. Just
Yeah.
the part about just meeting someone and it sounds like your focus is a lot on waiting for that change, that change talk to come out of them. Whereas,
Well, the change talk comes out because you're doing a lot of reflections, and there's a lot of open questions and a lot of reflections. So you're really giving them a chance to express themselves, to speak, and really be heard.
Mm-hmm.
So I think the goal is to really make it clear that you're really wanting to understand them.
mm-hmm.
So I guess I see what you're. So it comes out. I mean, you can get it to come out quickly if we're talking about change. Now it's different if it's sort of an overarching goal rather than, because when we're seeing somebody for an MI session, they're coming in, like, they might come in because they got admitted to the hospital because they had an overdose or something. So it's kind of clear what their behavior change target is, although not always. So it's a little bit different. So I would say one thing you might reflect on is think about how much you're using, a very reflective style, a lot of open questions, a lot of just very much like how much are you getting to know them, how much are you just doing reflective stuff really, to ease that sort of awkwardness of getting to know somebody quickly and then forcing them to go for a goal. One of the things that, so just around open questions, there was some early research, there was some research in doctors' offices where they studied the impact of having doctors ask the simple question of their patients, what's most important for you to talk about today versus not? So basically letting patients talk to their doctors. And doctors were terrified that patients were just gonna yammer and take up all their time and whatever. And they found, so they did a comparison of asking that question or not. And they found that patients were way more satisfied. It took up almost no more time. And patients actually felt like they got their concerns much more effectively addressed because they could come into the doc and say, well, I've had this growth or whatever that's been really bugging me and I'm really concerned about it, and rather than the doctor sweeping in and taking over their stuff. And it was interesting, like, we don't really want to talk to our doctors all that long, but when they just allow us that simple question of what's most important for you to talk about today, giving them some power really, really helps. So I might think about that, but I'm not sure if I have any better advice. Yeah.
Hold on, let me get you a microphone. We don't use the microphone. We can't have this on the video, which will be posted on YouTube, so that's why.
Is there any research around using motivational interviewing in a different format? Specifically, is there any research on, or what are your thoughts on its effectiveness in maybe just like email with some carefully chosen questions?
Good question. I don't know about its effectiveness with email or text. I would suspect its effectiveness will be diminished with the distance, the physical and emotional distance from the counselor. But I would also suspect that you could still get some effectiveness. I would guess that we could have a good distance. We could get a lot of bang for our bucks if we were doing MI through IM. I didn't mean that. But it sounds cool, right? MI through IM, or like, I know people actually do MI supervision through actually internet video chat. I would actually think email would be one step even removed because it's not as instantaneous. So the fluidity of the conversation, because so much of a conversation and so much of an MI interaction is doing that correctiveness in the reflections, right? It's sort of, did you mean this? Did you mean that? That happens sort of, inherently in a reflection. So I don't know that people have done that research. I would suspect that its effectiveness would be diminished, but I think it's important for us to be thinking about technological solutions for all the reasons that you could imagine. That it's cheaper, you could reach people in sort of poorer communities, remote communities, et cetera. Yeah, great question. Yeah.
Okay. So I work with doing consultation under like a coaching model in education. So we have coaches that are going into classroom environments, learning environments, and talking with educators about change that educators need to make within their learning environments. There has been some suggestion that motivational interviewing might be used as an interaction between coaches and teachers. My question is, do you think that that's valid, first of all, or that this tool is a tool that should be used in that context when you truly do have someone that's coming in with the idea of maybe being an expert? Yeah.
It's tricky because I think you really have to come in with, you can't come in with an agenda about what somebody's going to choose in the end. So you can't come in saying, I'm going to MI somebody into, first of all, you never MI somebody, no matter what my friends try to say to me. And you can't, so it's really, it's not going to be effective. And I also think it's not really ethical if you go in with an agenda to try to get somebody to make a specific change, because then you're not being collaborative and you're not being genuine, in trying to help somebody make a change that's theirs. And I also think a principle of MI that I didn't really talk about, but a principle of MI is that in the end, not only is it the client's choice to change, but how they make that change is up to them. So we usually like in the end is if a person's going to make a change that they have a bunch of choices to make. Because I think it's pretty rare that, now I mean if we're talking like diabetes management or, it's pretty rare that somebody has one choice to make. So like, I mean if it's diabetes management, it's not like you can choose insulin or something other than insulin. But you can choose a lot of ways to manage how you take your insulin. You can do a pump, you can do injections, you can, and you can do a lot of ways about how you remind yourself to take your insulin or something. So we think that freedom of choice is really important. So if you have some kind of agenda where you're gonna get somebody to do something, and you're not gonna have that choice as being an important part, I think there isn't a good fit. However, if in the end there is a choice for the person, and you're really helping the person sort of come to decide what they want to do, and they have a menu of options of things that they can choose, I think it could be a good fit. So I think it's tricky, and I think the further away you get from behaviors that people can change that don't have an obviously good solution or obviously good and bad choice, I think it ethically gets a lot trickier.
Because how it's been planted is like you go in and encounter resistance
Yeah.
on the part of someone who, an educator for whatever reason that needs to change for evaluative purposes.
Yeah.
And you encounter this resistance, and so you as like a coach, you use these motivational interviewing techniques to help combat that resistance, and it sounds like that's just not a good match. Because
Yeah.
ultimately like that resistance is occurring more probably on a systemic level than on a
I guess it depends on what change you're looking for. I mean, there's, if you're encountering resistance and and you go from being you go to being listening and reflecting and non-confrontational. I mean, there's no harm in, not being confrontational, right? I mean, I think there's, right? I mean, that's what we're talking when we're talking about rolling with resistance in MI literature. That's what we mean is just like you're using reflections and listening skills. And open questions rather than arguing with somebody. So I don't know that there's necessarily any harm with that. It's really more about the use of the change talk and the guiding strategies of MI that I would start to say it's a little bit more ethically dubious to use if you have a specific agenda for somebody in mind. Yeah, that's a great question. I think ethical issues with MI are really important to consider. And I'm not the foremost authority on it either.
Okay, I think we probably have to wrap things up here. But thank you all so much again for coming. And our next lecture will be in December. It's the second Thursday of every month until the end of the school year in June. The December upcoming lecture will be with Dr. Georgiana Sedlar, and she'll be talking about updates in parenting therapy techniques. So that will be extremely interesting as well. Thank you all for coming. Please leave your evaluations either where you're sitting or here at the end of this front table. And you're always welcome to check out our YouTube channel or our blog as well. So thanks so much and have a good afternoon.